Hi, I'm Don Weaver, Senior Advisor for Clinical Workforce at the National Association of Community Health Centers. Today, I'm going to provide a brief background on reimagining tobacco cessation for the Million Hearts Learning Lab on the same topic. Smoking remains the leading cause of preventable disease, disability, and death in the United States, although the percentage of adults who smoke is at an all-time low in the United States. 34 million people still smoke. Smoking cigarettes can harm nearly every part of the body. According to the American Heart Association, cardiovascular disease accounts for about 800,000 deaths every year, and it's estimated that nearly 20% are due to cigarette smoking. And the effects of smoking are not just on the smoker. Secondhand smoke affects babies, children, and other adults. Smoking disproportionately affects the poor, the homeless, racial minorities, LGBTQ plus persons, and those suffering from mental illness and substance use disorder. While there have been declines in both youth and adult tobacco use in America, gaps in health equity persist. Recent studies indicate an exceptionally high burden of tobacco use among health center patients. So the national number is 12.5% of people smoking. At health centers, it's almost 30%. With that in mind, NACHC partnered with the Centers for Disease Control and Prevention, CDC, and the primary care associations in Louisiana and Ohio, as well as 6 health centers, to help healthcare teams support patients who wish to quit tobacco use or who should quit. Our charge was to adapt the Million Hearts Tobacco Cessation Change Package for health centers. I think we can all agree that in health centers, tobacco cessation programs provide the opportunity to promote health prevention and to address health equity. Health centers are the perfect place to do that. Tobacco cessation is a team sport. Evidence-based treatments work, and let's talk a little bit about evidence-based treatments. There are 3 forms of counseling: individual, group, and telephone. There are 7 medications currently approved by the Food and Drug Administration, FDA, including 5 forms of nicotine replacement therapy and 2 non-nicotine medications. Combining counseling and medications can more than double the chances of successfully quitting. And of course, text messages and web-based cessation interventions can help people successfully quit smoking. There are a variety of resources that are available. Many have found the need to have a systemic approach very helpful, and some find that approach included in the 5 A's: ask, advise, assess, assist, and arrange. Let's go into those in a little bit of additional detail. Ask, identify and document tobacco use status for every patient at every visit. The good news is you're already doing that in UDS, and the data shows that people are doing that extremely well. You may even wish to develop your own vital signs sticker based on the sample that we've included in the packet. The next step is to advise. In a clear, strong, and personalized manner, urge every tobacco user to quit. Then you need to assess, is the tobacco user willing to make a quit attempt at this time? I will parenthetically put in at this particular point that the estimates range from 6.1 to almost 30 times that people need to attempt quitting before they are successful in their efforts. So assessing whether they are willing to make a quit attempt is extremely important. Then it's time to assist the patient. For the patient willing to make a quit attempt, using counseling and or pharmacotherapy to help him or her quit is the next step and extremely important. And then arrange, schedule follow-up contact in person or by telephone, particularly within the first week after the quit. Again, a systemic way of looking at approaching an individual with regard to tobacco cessation: ask, advise, assess, assist, and arrange. The multidisciplinary approach is one thing that really came out loud and clear in the work that we've done over the past 2 years with the health centers and the primary care associations in the states that I mentioned. The main lesson learned, if you wanted to take it home from this slide, is that the team approach to care is a multidisciplinary one, and that's the one that's most successful. For this particular project, we focused on dental professionals, pharmacists and pharmacy staff, behavioral health specialists, and some use their community health workers. But don't forget everyone on the team. You almost need a checklist to say, are we all in, and who are the people that are the trusted messengers that patients will seek their advice and counsel? And that includes nurses, that includes medical assistants, that includes dental assistants, and it also includes that person at the front desk that might say, if you're interested in stopping your use of tobacco, we have a team that's willing to do that. There are a variety of new NAC resources that help health centers reach tobacco cessation goals. I won't read these to you, but you can certainly look at these guides that were developed. And a big thanks goes out again to the health centers, to the Primary Care Association, and to our colleagues at CDC for helping us put these together. As I mentioned in the beginning, this is an adaptation of the Million Hearts Tobacco Cessation Change Package, specifically developed for health centers. It's organized by each change concept and change idea, and offers additional resources that are not included in the current tobacco cessation change package. So I think as you go through these particular resources, you will find some very useful helps and tips to move forward. This just a slide reminds us that there's a little bit more, that these were tested in health centers. You learn from your colleagues. We listed the people who have assisted us in this project, and a shout out to all of them in the midst of the pandemic, that they persisted and were successful in getting to where we need to be. And it's also a reminder that as you apply these, you will learn new things. And we encourage you to share them with us, because the only way we all get better at doing what we do is trying things out. And as we all know, the PDSA cycle is extremely important. And when you learn something, please bring it back to us so we can help you share it with everyone else. Again, the guide will provide you with information on these resources. And what I would encourage you to think about is what can be the helps to you as you put together your particular change package. Our last slide talks about a fact sheet about tobacco cessation. It covers the who, what, who, and how. Efforts can be accomplished with success at health centers. And I would particularly call your attention to, in the midst of a busy visit, take a look at the aids that can help you, whether that's your electronic health record and pop-up messages, whether that's population health dashboards, whether that's reimbursement tips, whether that's health center requirements for tobacco cessation counseling, whatever it is, anything that you can put in place, as you know better than I, in the midst of a very busy day and a busy visit, to address this extremely important issue is well worth the time and effort in setting up, because what you can put into place in a systems approach really leads you to getting the result that we all want. And that is, as I mentioned before, it's getting everyone to quit smoking, and in the process of doing that, eliminating health disparities, because the populations that we're privileged to serve are disproportionately affected by tobacco and the addictive nature of nicotine.